So our first question is, what are some common reasons why patients come to a breast surgeon?
So as a breast surgeon, I see a variety of patients who come to see me for a variety of breast issues. So they can have benign issues, meaning those that are not cancer related, or they might come to me for a cancer. They might see me for abnormal breast imaging, like a mammogram or an ultrasound or a breast MRI, or they might see me because they've noticed something on examination of their breasts themselves, or maybe their doctor who they saw, their OBGYN doctor or their primary care doctor, maybe they saw something or noticed something on the exam and they would refer the patient to me for evaluation.
And then what would be some examples of like benign issues, like things that aren't cancer?
It depends on people's age group sometimes. We can have some benign breast complaints that can be more age-related. So, for example, in a younger woman, they might have a fibroadenoma, which is a benign tumor of the breast.
Okay.
Sometimes we remove by surgery, sometimes we don't. Maybe the patient, another benign thing might be maybe they have nipple discharge, maybe they have breast pain, maybe they have a skin rash, things like that. Maybe they have lymph nodes under the arm. All of those things sometimes can be related to cancerous findings, but most of the time, those things are not necessarily something that would have to be dealt with surgically speaking, or would necessarily be related to breast cancer. But I think the key there, any seemingly benign or innocuous, meaning not so concerning finding of the breast, really should still be seen by a breast specialist just to make certain.
Okay.
So what is a lumpectomy and how do you localize the lumpectomy?
Yep. So if a patient presents to us with a cancer of the breast, there's really two ways to take care of that cancer fundamentally. One is to try to save the woman's breast and just remove the area of interest or the cancer, or the other option is just to remove the breast. So specifically what you're asking about is a lumpectomy, and as the name implies, lump and ectomy. The portion of the word ectomy means to remove something. So here it's a lumpectomy. We're removing the lump, but leaving the patient's breast intact. So in order for us to do that, we have to localize the cancer. Sometimes the cancer might be where we can feel it in the breast and say, oh, here it is. Let me make an incision and take this lump out. But many, many times, and even if we can feel it, sometimes we want to be extra careful to make certain we get out the right lump. We would put a localizing device. So by a needle, our colleagues, the radiologists, would insert a needle in the breast into the lump after it's been biopsied and diagnosed as a cancer, of course. But in a separate procedure, they put a needle and they would deploy a very small device, for example, or sometimes a wire is placed. And those are things that we use that help us to find the cancer to make certain that we're not removing the wrong lump. If they put a device, those devices are typically attached to a handheld probe, meaning the device is in the woman's breast. We take a probe in the operating room and we pass it over the breast, and typically it'll make a sound through a console or a device over here outside of the patient and shows us where it is. It'd be very similar to if you've ever seen anyone on the beach with a machine that tries to find gold watches or medals. It's sort of like that. So the device is in the breast. We use a probe outside of the breast to find the area. It'll make a noise. We say, oh, here it is, and then we plan out an incision. That would be a lumpectomy, and that's how we localize it.
So then what makes you choose between like a mastectomy? Why would people receive a mastectomy instead of a lumpectomy?
So first, let's define a mastectomy. So the opposite of the lumpectomy, right, is a mastectomy. So here you have the word again, ectomy, to remove, and mast is breast, so mastectomy means to remove the breast. So in opposition to lumpectomy is just to remove the entire breast. So it's a great question. How do you make that decision? There are some pieces of making that decision that are, from the physician looking at the case in its entirety, looking at the films, looking at the presentation, that the patient has clinically, meaning on their physical exam and their imaging, looking at the whole thing together. So for example, what if the woman has a smaller sized breast, but a larger sized lump? That might not be something that would lend itself to a lumpectomy. Maybe the patient would be better served with a mastectomy, because if we took a large lump out of a smaller breast, we might have a lot of deficit or deformity or asymmetry, unevenness, which might not be very pleasing to the patient. So that might be an example there for, of a mastectomy. How we make that decision, again, is looking at all the clinical factors, but another very, very important piece of this is how does the patient feel about it? So we have oftentimes patients can be either candidates. They can have a candidacy for lumpectomy or that for mastectomy. Meaning when I look at everything, I say, hey, you know what? We could do either one. Which one do you prefer? So we have to include the patient, obviously, in the conversation to see how they feel about things. Because, for example, just as a general statement, although there are exceptions, with a lumpectomy, if it's successful with getting the area out and our margins are clear, meaning we've gotten around everything, that woman might need, most of the time, radiation treatments or x-ray treatments after the lumpectomy. Versus in a mastectomy, most of the time, with exceptions though, they have the breast removed and they don't need radiation. So maybe that patient, for example, radiations every day for several weeks, maybe that patient can't come to a facility every day to have radiation. So maybe she chooses mastectomy instead of lumpectomy because, again, there's other things involved that maybe she can't make the commitment. So it's just a number of things, not only clinically, but also the patient's choice.
So when a patient goes through radiation, it only depends on like whether they get a lumpectomy or a mastectomy?
That's one
like
factor.
after surgery?
Oh, sorry. Yes, that's one factor. So most of the time with a lumpectomy, one does radiation. Sometimes with mastectomy, one needs radiation. What if it's a larger cancer in the mastectomy specimen? What if lymph nodes under the arm are involved? Those might be characteristics of a mastectomy that would lend itself to needing radiation as well after surgery. So interestingly, nothing is really very exclusive, right? Some of these treatments might need to be given for different types of surgery, but it all depends on the final pathology results or the final results of the surgery in terms of how big is that cancer, are the margins clear, are the nodes involved, are they not involved? Those would be some factors that get factored in. Some variables that get factored in as to whether someone needs radiation or not.
Now, what exactly does the radiation do to the lump?
So it's a little bit complicated, but we'll try to just sort of simplify it to say that after the lumpectomy is performed, the radiation, we can look at it as sort of an adjunct or an additive to help to treat the entire area to try to minimize the potential for a cancer coming back. And it can act in that very same way with a mastectomy. If the features of the mastectomy, the size of the cancer, was there skin involvement, are the margins closed, what about the nodes? If there's features of that mastectomy specimen that lend themselves to radiation, the idea behind the radiation is to try to minimize cancer recurrence.
Okay. And then just like on average, how long does it take for a patient to recover from like a breast cancer surgery?
Yeah. So with a lumpectomy, in general, it's probably fairly safe to say that about a 2-week recovery is necessary. And it doesn't mean the patient is at home in bed, not able to move around, but they might be slow to feel well again, and they might get tired during the day. Again, allowing the body's, taking all the resources of the body to heal the area that we've operated on. So those are resources the patient won't have, right, to get around and do their normal activities. So I would say for lumpectomy, it's usually 2 weeks. And then with mastectomy, because it's a larger surgery, again, body using resources to heal a larger wound, a larger area, it's probably somewhere in the order of 4 weeks. sometimes after mastectomy, patients choose to have reconstruction or have a plastic surgeon work with the breast surgeon to try to build something new for them. And so those recoveries can be a bit longer as well, maybe into the 6 to 8 week recovery period.
So after recovery, how long do you follow up with the patients?
So our patients are very important to us, and we like to follow them for just their long-term care, right, to make sure that they're doing well and getting along after all the various treatments they may have gotten for their cancer. So in general, it'd probably be fairly safe to say that most of the time we follow our cancer patients every 6 months for approximately 3 years. So we would see them, every 6 months, so twice a year for about 3 years. And then we would probably then start to lengthen that out a bit. And so for another 2 years, we might see them just yearly. So we'd say maybe a 5-year period for the surgeon, every 6 months for the first 3 years, and then yearly for the other additional 2 years. And then here at this institution, we typically refer them on to our survivorship clinic. These patients still sometimes have long-term side effects from their therapies, whether that's radiation, chemotherapy, surgery, endocrine therapy, or anti-hormone pills. So we have even another clinic they would follow in yearly to check the area of interest where they've had their surgery, but also just to see how they're doing long-term, and are they experiencing any long-term side effects.
Well, I think that's all the questions that we have. Thank you so much for coming. I know that you're really busy. We really appreciate you for taking time out of your day to do this.
It was my pleasure, and I appreciate the interest in the breast patient. So good luck to you. Thank you for taking time out.
Yeah,
Thank you so much.
Please check out the 2 videos on your screen and subscribe to our channel as well. Thank you.